Yeah. Hello, everybody.
Hi everyone.
Welcome to our show. My name is Serge, and this is.
My name is Claude.
So, this month is Breast Cancer Awareness Month. I believe that you all know that the whole month of October is dedicated to breast cancer awareness. So, it's natural that we dedicate a whole episode on breast cancer. You see, 1 in 8 women in the US will develop it in their lifetime. 1 in 8, that's 12% of the women population in the United States.
And in 2017 alone, about 300,000 females were diagnosed as new cases for breast cancer.
And in 2017, it is expected to cause more than 40,000 deaths. So this is a big issue. This is why we want to talk about it. We want to talk about breast cancer. So welcome to Wellbeing Makes Sense. So basically, what is cancer?
What is cancer? Cancer, in layman's term, we can describe it as just a abnormal growth of abnormal cells. You know, cells are our body makes for day to day, and somehow some of them got mutated, they got changed, and they just grow without control.
And because we have cells in pretty much our body is made of cells, every organ in our body is made of cells. Basically, cancer can develop in pretty much any organ.
Yes.
You know, lung cancer, skin cancer, and of course the one that we are talking about today, breast cancer. So let's talk a little bit about the female breast, and then we're gonna try to explain to you what breast cancer is.
So, I wanted to use Serge as the dummy, but he kind of chickened out. So we have the latest technology. As you can see, this is the anatomy of the female breast. This is the outside that you're looking at. This is the skin, and this is the nipple. So, as young females, your breast is very dense, and as you get older, the density lessens. So let's look at the bottom layer. You would find the fat of the breast, and we have the blood vessels supplying the fat of the breast. As you go below it, we have the ducts and the lobules. So the third layer, the deeper one, we have the ducts that ends in the nipple area, and we have the lobes making from different lobules, multiple lobules, and you see the blood vessels, and we have the lymph nodes. So there are different types of breast cancer. We have breast cancer that starts in the lobes, called lobular breast cancer, and we have the ones that starts in the duct, called ductal carcinoma. So you have lobular carcinoma and ductal carcinoma, and there's different subtypes and types of breast cancer. What are the signs and symptoms of breast cancer?
Well, the first thing to look at is for a lump in the breast.
Right.
Because like we said, when the mass start to form in the lobes or in the dark, you're gonna start feeling it on your breast. Alright, so depending of where it's growing, you can feel it over here, and in different part of the breast. So that's why it's important that we do breast self-examination.
Yes.
And how do we do that?
So how do you do it? You basically start from the outer edge and you run your fingers along till the nipple, all around your breasts. And it's very important that women, even some males, get used to feeling how they breast feel. Okay, in medical school, there's this thing: the more normal you see, the more easier to notice the abnormal. So get to practice. Know how your normal breast tissue feels. Like the minute that you feel something abnormal, you know, there can be indication to further investigate what could be wrong. Okay, and make sure that sometimes you press the nipple, make sure there's no discharge.
Because fluids coming out your nipple is also a sign of breast cancer.
These are lymph nodes. You know, the lymph nodes are like the cleaning house of the body. So they're part of your immune system. So once something goes bad anywhere, the lymph nodes attacks and cleans it. So very important during your self-examination that you feel your lymph nodes in your upper chest area. You feel lymph nodes underneath your arm, underneath on the side of your breast, to make sure that there's no inflammation, there's no enlargement, or there's no pain. So don't forget to check the breasts as well as your lymph nodes, because breast tissue, breast cancer tend to move through the other area, especially the lymph nodes.
And that's really how it spreads, you know, starting from the breast and then start spreading to the lymph nodes, and that's how you go to the different stages, 1, 2, 3, 4, and total get to your brain and everywhere else in your body. So remember to check these parts. And also we can notice a change in the breast shape, because as the lump is getting bigger and bigger, that's gonna affect the shape of your breast. So this is another sign of breast cancer.
When you have, along with the shape, when you start having a dimpling, you know, a concave dimpling of your breast tissue, that's an indication as well.
You know, dimples, what's like your dimple? Should your dimple. There you go, there you go, right here,
Yes.
right here. So if you feel that, if you see that, know that that's also a sign.
So we spoke about the fluid coming from the nipple, and there is if there's a change in the skin as well, you know, red, scaly change of your skin. We learn it as peau d'orange. So if you study how the orange is, you can see there's little dimples and scaly of the orange peel. So as your skin, your breast skin changes, you know, these are indication as well of possible breast cancer.
So, and how do we diagnose breast cancer?
So we have mammogram to pick up abnormal cells. If and when there's an abnormal mammogram, then your doctor would do ultrasound, looking to see where the quality, it gives a score to the breasts, the mass. And then the ultimate definitive diagnosis is biopsy.
And quickly, we're gonna say that there are quite a few treatments out there to help with breast cancer, starting with surgery, radiation therapy, chemotherapy, and targeted therapy. These are the traditional
Those are the modern treatments.
exactly,
right?
for breast cancer. But if we are doing this video, is mostly because we want to work on the prevention. It's a good thing to explain to you what it is, but the best part of it is that we can reduce the risk of breast cancer. Now, we can't totally guarantee you that you will never have it. We haven't invented that method yet, but there's stuff that you can do to help reduce the risk of having breast cancer.
So what are the risk factors of
So
breast cancer?
one of the we're gonna give you a few risk factors, starting with obesity. Obesity is one of the main risk factors of breast cancer. So your weight is very important. The bigger you are, basically, your risk become higher as you get bigger.
Having a sedentary life also increases your risk. Lack of exercise, excessive alcohol use also increases your risk of breast cancer.
Also, hormone replacement therapy. As women are going through menopause, many choose to use hormone replacement therapy to help them with the symptoms that we're experiencing. I know some women can have very, very tough symptoms, things that they can't deal with it. So they have to go to hormone replacement therapy to help them alleviate those symptoms.
We have genetics as well. Family history plays a role. Early menstruation or late pregnancy also shown to prove that this is a risk factor for getting breast cancer.
Late pregnancy, if people, a lot of people focus more on their career now, and they are getting pushing pregnancy into a later age. So they found that people who have late pregnancy and women who have never been pregnant have an increased risk of breast cancer.
So let's discuss the prevention.
Yeah. So some of the preventions are pretty easy, because once you know the risk factors, you can tackle them, and this way you lower your risk. One of the first one we can tackle is your alcohol use. So if you drank a lot of alcohol, then recommend that you cut it back. Actually, recommend that you do no alcohol. All right, there's alcohol has no benefit to your health, has no benefit to your body, and it doesn't just increase your risk for breast cancer, but also attack many other organs in your body, your liver, and a lot of, not to mention how it affects your brain after you drink it. So stay away from alcohol. This is good and sound advice.
So, like we say, obesity is a risk factor, so having a healthy weight, exercising, definitely improve the risk factors. And let's focus on a healthy diet.
Healthy diet. Basically, we recommend a plant-based diet. The more you stay away from meat and all these high-fat food, the better it is. And you want food that are high in citrus fruits, like orange, for example. Actually, here's yours.
Thank you very much.
You don't need the
Oh yes.
peel.
Thank you for peeling it for me.
Yeah. So, and also want food that are rich in omega-3 fatty acid. What about exercise? Can you tell us?
Exercise. Again, the recommendation is having an elevated heart rate for about 30 minutes a day. Definitely improve on your feeling good, improve on your weight, decreases your risk for cancer.
Okay. Breastfeeding is a pretty good one. Once you have kids, we know that a lot of women nowadays, they more trying to be more modern and avoid breastfeeding. So there's a whole campaign out there to for breastfeeding now. Breastfeeding, your milk is a blessing to the child. Your milk, that's what helps your child grow, your baby grow. and it's not only a benefit for the baby, but it's also a benefit for you. As so it's shown that women who breastfeed, they have a lower risk of breast cancer.
Okay. And we spoke about the hormonal replacement therapy. If you suffer from menopause, try to speak to your doctor or do some research about other ways to help you through that new life cycle. So avoiding hormonal replacement therapy is a benefit.
So these are the recommendations that we have for you. We know that there are a lot of other recommendations out there, especially now there's a trend of double mastectomy as a prevention, and we see that many people who have no signs of breast cancer, but they will, to lower their risk, they will go and have double mastectomy, and even the athletes and many stars are following this trend. I don't think that's so far. There's no research really that can back this up, saying that it's happening anyway. So so try. You don't have to go to these extremes, all right? Try to lower your risk the natural way. Try to take charge of your health, take charge of your body, control what you're eating and drinking, and exercise. These are the main ways. These are proven methods to lower your risk of developing breast cancer. And for those out there who already have breast cancer, we tell you, courage. We know that it's tough. You're strong. You can go through this, and God will be with you as you go through your journey.
Yes. So thank you everyone for tuning in. Don't forget to subscribe. Check out our other videos, very informative. Do share and like, and please comment below to improve, to share with us your thoughts and everything else and everyone else. So bye everyone.
God bless.